Kia ora whānau, Victoria, the nurse from Bowel Cancer New Zealand here. Today, just answering a few questions around genetics and bowel cancer, hereditary things, and all of those questions that have been asked recently. Please note, this is really general information. That is not the be-all and end-all of everything. Also, keep in mind that if you do have bowel health concerns, you are worried about what's going on within your bowels, and or you have a long family history, please see your GP in the first instance and have a chat with them. It's important that you get these things investigated quickly. So, that being said, what do we mean by hereditary or that it runs in the family? Generally speaking, what that means is that it's more than one relative. So it could be your mother, and then your mum's mum, and then aunts and uncles on that side, and then going through the family that way. So it can be that it's yourself and someone else. That would mean it could potentially run in the family, or it could be that it's generational and you just want to check your own bowel health and make sure that you're actually okay. So yes, bowel cancer can be hereditary. You can have a genetic predisposition to getting it. What this actually means is that you may never ever develop bowel cancer in your life. However, given certain circumstances and given the right conditions, then it is possible that your risk will be increased and that you may well develop bowel cancer. So it's even more important that you be vigilant about things that are going on down there and make sure that you're keeping an eye on things. So getting that out of the way first up. So like I said, if it is something that's a little bit generational, and sometimes we're not always aware, back in the day, bowel cancer certainly wasn't very much talked about as it is nowadays. So it could be that not everybody is aware of their family history around this particular disease. So having a chat with your parents, having a chat with the wider whānau, and finding out what it is that has actually kind of been going on there can be really, really helpful. The other thing to keep in mind is your risk will mostly depend upon if it is generational, how many generations it goes back, but also if it is only just what we call a first degree relative. Now, first degree relative is mum, dad, sibling. So if it happens to have been one of those people within your whānau that was diagnosed with bowel cancer and they were under the age of 55, then your screening risk does become a little bit higher. And what they tend to do is that they will start to screen you from around about 10 years younger than your first degree relative was when they were originally diagnosed. What that means in layman's terms, if your dad was diagnosed and he was 53 years old, just as an example, that would mean that they would look to start screening you and any siblings that you might have at around about 43 years of age. That way they can keep an eye on what's actually going on. They'll remove any polyps or anything that they find and or take any biopsies that might be deemed necessary at the time when they're doing colonoscopies. So sometimes it does depend on age and when people were diagnosed. So the other thing to take into consideration is if the person in your family was a little bit older than that, but there's multiple people within that generational line, like I mentioned, your mum, her mum, aunts and uncles, all on your mum's side, that kind of thing, then that should be taken into consideration as well. And it's a conversation that needs to be had with your GP. They can then be the best advisors and find out if you fulfill criteria to have familial screening done. So it's really important to start there with your GP. So some of the other things. A lot of the mutations that we hear about now, BRAF, GRAS, KRAS, all sorts of other things. They can be genetic as well, purely and simply because certain types of tumours will tend to run in certain families. But also the thing to take into consideration is that how old you are, and where the tumor is actually situated in your bowel can determine those kind of genetic variations and mutations that may actually be there. So it's really important to know what side your bowel cancer is growing on, where it is exactly, and then making sure that you actually ask that those mutations have been done when it was sent for biopsy. That way they can also make sure that you're getting the best treatment options available to you. The odds of you getting or developing bowel cancer, if you do have a family history, again, to an extent, comes back to the age at which the people in your family were diagnosed, and also how many within your family lines have been diagnosed with it. So this is a little bit more tricky in that if it was a grandfather of yours and they were diagnosed in their, I don't know, mid-70s, shall we say, so still quite young, then you probably have about the same risk as Joe Normal out in the general population. It's not to say you will or won't develop bowel cancer in your lifetime. It just means that your risk is around about similar. Again, if it was your parent and they were in their mid to late 70s, then again, your risk would probably be similar to that of the public that doesn't have any family history. But again, at that kind of age, you'll be coming into the National Bowel Screening Program and will be sent bowel screening kits every couple of years. So that's always a good idea to make sure that you actually do those. So that's kind of a little bit about how that works. Again, very general information. There's a lot of information on the New Zealand Familiar website if you wanted to know a little bit more. And like I say, have a chat with your GP. You're also welcome to get in contact with me, and I'll hopefully be able to point you in the right direction if there's anything else that you want. As far as your children go, about getting colonoscopies, if you've been diagnosed under the age of 55, it will depend a little bit on how old your children are currently, and they wouldn't be starting to screen until, like I say, about 10 years prior to when you were originally diagnosed. That will change if there are genetic conditions within your family, such as Lynch syndrome or some of the multi-polyp syndromes that are out there. It's very difficult to pronounce names. If that runs in your family, then screening takes on a whole different look and feel, and it will depend on, getting some blood tests and things like that done on your children, but it will probably not start until their late teens or early 20s, purely and simply because they need to kind of develop and understand and all sorts of other things that need to be taken into consideration there. So that's really important to know as far as family history goes as well, whether or not those kind of disorders run in your family. There's quite a bit of information on our website regarding Lynch syndrome and some of those other genetic conditions. You can go to www.bowelcancernz.org.nz and you'll be able to find that on our tabs there. So do have a look if you're a little bit concerned about that. And screening, just as part of the National Bowel Screening Program, all of that criteria is set by the Ministry of Health and can be found on the Time to Screen website if you go and have a look there. This is not something that we as a charity have any control over, and we will continue to support and advocate for screening ages to be lowered. That being said, going back to my original statement, if you've got concerns about your own bowel health, if you've got concerns about bowel health history within your family, if you already have any sort of bowel conditions such as ulcerative colitis, diverticulitis, irritable bowel syndrome, those kind of things, they can also increase your risk, and you need to keep an eye on those kind of things. Please see your GP. if any of this is of concern to you, and they will be able to help you. They can check the criteria for familial screening and then refer you on if absolutely necessary. And then you can access all of those kind of tests and things that you actually need. I hope this has been helpful. And please, if there's any questions, do get hold of us.